As reported in Science Daily, black patients with kidney cancer have poorer survival than whites. Among patients with the most common form of kidney cancer, whites consistently have a survival advantage regardless of patient and tumor characteristics or surgical treatment. That's the conclusion of a new study published early online in Cancer, a peer-reviewed journal of the American Cancer Society. The study's results suggest that additional efforts are needed to prolong the survival of all patients with kidney cancer. Wong-Ho Cho, Ph.D. at the University of Texas MD Anderson Cancer Center in Houston says, and I quote, "We cannot rule out the possibility that other factors not measured in the study, such as obesity, high blood pressure, access to care, and genetic susceptibility, may be contributing to the persistent disparities." Reporting from suburban Chicago, I'm Bill Bro.
My name is Olka Vaishampayan, and I am the chair of the GU multidisciplinary team at Barbara Ann Karmanos Cancer Institute in Detroit, Michigan. This cancer center is a NCI-designated comprehensive cancer center and affiliated with Wayne State University in Michigan as well. My practice and focus is genitourinary cancers, specifically within kidney cancer. My clinical practice is focused on kidney cancer, along with, as well as my clinical research is focused on kidney cancer as well. Patients get the awareness of not just new treatments, because new treatments are frequently publicized all over the press, TV, newspapers, whatever. But they also realize, or the information is transmitted about how we are fine-tuning the existing therapies to serve them better. And the optimal treatment is still being decided for an individual patient. And we are really at the beginning of getting different genetic markers that may help us predict response. My presentation today is focusing within patient management issues of the disparities in treatment of kidney cancer. So even though we've improved outcomes tremendously in the last few years in kidney cancer, that in itself has caused a huge disparity gap to widen between the different people who don't have access to treatment, who have multiple other comorbid conditions that interfere with them receiving the optimal treatment, and of course, race and socioeconomic factors, as well as the biological factors within the cancer that induce all of these disparities. I think what patients should ask, first of all, is what is going to be the overall treatment plan. So not just the type of medication, but how are different modalities going to be integrated into their treatment. So probably the question needs to be, am I a candidate for both surgery as well as receiving treatment in terms of different targeted therapies, or is it just going to be targeted therapies or some kind of systemic therapy first, followed by the consideration of local therapies? So I think patients should be more aware and asking questions about consideration of multidisciplinary care. The other thing I think patients should become more aware of and be asking about is, are there any clinical trials that are appropriate to my situation? Because typically what we find is that clinical trials in kidney cancer, especially in the last few years, have represented the most cutting-edge type of treatment and has benefited majority of the patients who have enrolled on it. So I would say those would probably be the top two questions I would recommend patients ask.